Well, I want to thank you all for coming, and I want to thank the office staff. I want to thank Shelley Hillesheim for providing the nice hors d'oeuvres. How many of you before tonight have heard of leaky gut syndrome? So a lot of you have heard about it. You know, it's a diagnosis that's been put forth by naturopaths and functional medicine practitioners for years, but I think conventional medicine still considers it kind of a quack diagnosis. I'm not crazy about the name leaky gut syndrome. The conventional doctors are calling it increased mucosal permeability or hyperpermeability syndrome. It's like saying tennis elbow or lateral epicondylitis. You're really describing the same thing, and one sounds more scientific than the other. And I really do think that this is going to be one of the biggest medical stories in our lifetimes once it's all said and done. And it was Hippocrates who said 2,000 years ago that all diseases begin in the gut. And it turns out he was probably right. And if you accept or embrace that concept now, it's not too late to become an early adopter some 2,000 years later. So he was a pretty smart guy. Okay. So I want to talk about a patient. I'm going to present a few case presentations. This is a real patient, 47-year-old female accountant, who presented with the chief complaint of palpitations. She also had irritable bowel syndrome, fibromyalgia or chronic fatigue syndrome, migraine headaches, anxiety, insomnia, restless leg syndrome, and gastrointestinal reflux disease. Now, when I first started practice some 27 years ago, if I would have seen this patient on my schedule, I would have written 2 prescriptions. Both for Prozac, one for me and one for the patient. And it turns out a lot of these patients, I had no idea how to help them or how to deal with them. And they really were the ones that just seemed very overwhelming. And I think to most doctors, they're not the ones that they want to see, on their schedule. Now, as it turns out, she came to me with palpitations. My first rule is that every patient complaint's a drug side effect until proven otherwise. And it turns out that her palpitations began when she was started on Mirapex by a neurologist for her restless leg syndrome, which was one of her problems. And it turns out that her restless leg syndrome was really the result of iron deficiency because she was on one of the acid blocking medications like Prilosec to treat her reflux disease. So she's on a medication to treat her reflux, and then she gets put on another medication to treat the palpitations. And it turns out that her reflux was actually on the basis of gluten sensitivity. So at the end of the day, we got her off of gluten, got her off of her Prilosec, got her off of the medications for a restless leg syndrome, and all of these things went away. Now, I saw this patient before I really understood, leaky gut syndrome and what that meant. And as we go through tonight's discussion, I think you'll have a little better understanding of how all this ties together. So as many of you know, and as Lauren mentioned, I've written a few books on irritable bowel syndrome. I've lectured to thousands of doctors over the years, literally on irritable bowel syndrome. And I'm not bragging, I'm just here to tell you, I've been kind of studying this for most of the time that I've been in practice. And one of my main interests is in food intolerances and food sensitivities. We're going to talk a lot tonight about foods and how you can react to foods, and particularly gluten. You're going to hear a lot about gluten tonight, and you're going to think that maybe this is just a talk on gluten, and it's really not. It's just that gluten is a major player in trying to understand leaky gut syndrome and irritable bowel syndrome. Years ago, I would ask patients to go off gluten, eggs, and dairy before we had any blood tests to really see if you were reacting or not, and it was just on a trial basis. And it struck me how much better these patients felt, not just from the standpoint of their digestive symptom, but a lot of other things like fibromyalgia and autoimmune disorders and so forth. Dr. Camilleri's from the Mayo Clinic, and this is from a Medscape presentation that I listened to a few months ago on irritable bowel syndrome. And the thing that struck me is that here mainstream is beginning to accept the notion of increased mucosal permeability as a cause for irritable bowel syndrome, which has been my area of interest. And if we can have the next slide. And so this is a slide from his presentation, and the thing that I just want to point out a couple things. One, what does increased permeability mean? Leaky gut. It's just another way of saying it. And here are all the different things that can contribute to leaky gut. So you've got bacterial ecology, which really is an imbalance of good and bad bacteria in the gut. You have irritants. There's a question mark by gluten. I would change this slide and put an exclamation point after gluten rather than a question mark before gluten. You've got excess bile acids. You know, here was the focus for years with irritable bowel syndrome. Now realize I've been to meetings with Dr. Guillory and a lot of other people interested in IBS for years and years. And, you know, a lot of these experts in the area would have told you that this really is a psychosomatic disorder. All the patients with IBS are just a little bit, you know, they really need to be on Prozac. And that couldn't be further from the truth. But what hopefully I can help you understand by the time the night is over is how there are a lot of psychological things that go along with leaky gut, but it's sort of the chicken or the egg. You know, what comes first, the leaky gut and then the psychological issues or mood disorders? Or is it the mood disorders causing the gut symptoms? So if we can have the next slide. So what is leaky gut? Well, leaky gut is when you have increased mucosal permeability in the lining of the small intestine. Now imagine this for a minute. The lining of the small intestine is one cell layer thick, and it's the size of a tennis court. So you have to keep the junk in the intestine and allow the nutrients to be absorbed across this one cell membrane layer. And when I was in medical school back in the 80s, we were taught that the lining of the mucosa was sort of bricks and mortar, and that all of the nutrients were absorbed across the cell, or what we call transcellularly. But it turns out that the food particles that we absorb are absorbed between the cells or paracellularly. And these so-called tight junctions open and close, allowing food particles to be absorbed down here into the bloodstream. And the thing that opens the tight junctions is a molecule called Zhan Yulin that we're going to talk more about in just a second. Think of Zhan Yulin as a garage door. You hit the button, garage door opens, you drive the car in, you hit the button again, the garage door closes. With leaky gut, the garage door stays open. And if you kept your garage door open, then bad things could happen. Burglars could get in your house and you could have a home invasion, and that's basically what happens with leaky gut. And it really was the discovery of Zhan Yulin, which is a human protein molecule that was discovered when they were looking for a vaccine to Vibrio cholera, which is one of the most common causes of diarrhea worldwide, major cause of death. And Vibrio cholera secretes a toxin that is very similar to Zhan Yulin, and this kind of blew everybody away because it changed the thinking. It's like, really? The food is absorbed between the cells and not across the cells? And so Zhan Yulin modulates the permeability of these tight junctions. And it's interesting, and again, here's where we keep going back to celiac or gluten sensitivity. Celiac patients have higher Zhan Yulin levels. So if you measure Zhan Yulin levels in celiac patients, which you can do in the blood, the levels are going to be higher. So what are the causes of leaky gut? And this is really a partial list. But basically, it's medications. So ibuprofen would probably lead the list. So chronic use of ibuprofen can irritate the intestinal mucosa and cause damage and cause leaky gut. And what's ironic is patients have leaky gut for some other reason, and now they feel bad. They've got, let's say, chronic fatigue, and so what do they take to ease the pain? They take ibuprofen, which just exacerbates the problem. So when we get into talking about how we address this in patients, you'll see that you have to look at a lot of different facets. And then the other thing is food reactions. Gluten, dairy, and eggs are the most common things that we see. When I wrote the first book in 1989, which was a memorable year for other reasons, we would tell patients, we didn't have blood tests for celiac disease, and we would put patients on an elimination diet, and we would ask them to just eat rice and chicken, which were very hypoallergenic, and then we'd gradually add food groups. And I concluded way back then, back in 1990, that this was a big factor in terms of IBS. But then a strange thing happened. Within a span of 2 weeks, I got 2 letters from different patients. One had rheumatoid arthritis and one had lupus. And they both said that after going on the elimination diet that their digestive symptoms, their IBS got better, but their rheumatoid went away in one case and their lupus went away in another case. And so I went to the library. This is before the internet, where you actually had to go to the library, look stuff up, make copies. I mean, it was a very arduous process to do research like that. And I concluded that it was probably gluten that was the culprit. And at the time, I had an office manager with lupus, and I had a nurse practitioner with rheumatoid. And I said, you've got to go off gluten for me and see if you get better. And they both did. Now back then, when you mentioned gluten, everyone's eyes got big. They had no idea what you were talking about. And now, probably every one of you here knows somebody that's off gluten or might even be celiac. And so they both did. They both got better. Their symptoms went away completely. So that was kind of the beginning of my looking into foods and how it might contribute to autoimmune disorders. But what you'll learn tonight is we really have the science kind of catching up with what I've observed over the years. If you could go back. The other thing is pathogenic microorganisms. The first time I heard about yeast overgrowth in the 80s, I thought that sounded kind of hokey too, but it turns out that a lot of people do have excessive yeast in their intestinal tract. That's another thing that can contribute to leaky gut syndrome. And it's the patient who's been on a lot of antibiotics. One of the real key indicators of yeast overgrowth is an intolerance to alcohol. So patients with yeast overgrowth, if they have a little alcohol, it seems to affect them a lot more than someone who doesn't have yeast overgrowth. And it really has to do with how the yeast digests, if you will, the alcohol. And the yeast is more efficient at converting the alcohol into acetaldehyde, which is the compound that builds up that gives you that bad feeling when you've had too much to drink. We'll go ahead with the next slide. So here's a list of possible associations for leaky gut syndrome. And you might say, well, gosh, that's almost everything you can think of. And the fact of the matter is, yes, everything that you think of might be related to this. In a lot of cases it is, but most of your autoimmune diseases are related to leaky gut and gluten sensitivity, which kind of go hand in hand and at least make each other worse. I can't tell you how many patients with psoriasis we've seen that we've fixed their leaky gut, the psoriasis goes away. We had a medical assistant recently who had just joined our practice, and he was there on a temporary basis, and he said, I think somebody sent me here for a reason because my psoriasis is gone now that you've got me off gluten and we've done a few things to treat the gut. Now he was spending about, $5,000 a month on Enbrel, which is used to treat psoriasis. So we're talking, huge dollars. And when you look at how out of control healthcare costs are, we have an unsustainable healthcare system. So anything that you can do to help yourself is going to really reduce your own personal costs. And I think what you really need to consider is the fact that all diseases begin in the gut. Hippocrates is right, and you need to work on getting your gut healthy before you start doing any other things. And then you can end up with iron deficiency that can cause a whole host of problems, magnesium deficiency. There's over 300 functions for magnesium in the body. So if you're magnesium deficient because you have leaky gut and you're not able to absorb it or you're leaching it out, then that's how you can get all these other problems. So if we can have the next slide. I want to talk a minute about celiac disease or celiac sprue. And you have to kind of follow me for a second. 25% of the population has the gene for celiac disease. So 1 in 4 of you is carrying the gene for celiac. Now that's not to say that you have celiac. It would be like saying you carry the gene for breast cancer. That doesn't mean you have breast cancer. It means you just carry the gene. Of the 25% of the population that has the gene for celiac, 1% of the population actually has celiac disease. So if you measured the blood, you would find that 1% are actually making antibodies to transglutaminase, which is the biological marker that defines celiac disease. Before we had these blood tests, you actually had to go down with a scope, do a biopsy, and that's how you made a diagnosis of celiac disease. So a quarter of the population has celiac. 1% of the 25% of the population carries the gene. 1% of the population has celiac disease. There's been a 400% increase in the last few decades. Now, when I was in medical school, we were taught that celiac disease affected about 1 in 3,000 people. I never expected to see a case because I was going to be an internist, and celiac disease was usually diagnosed in childhood as failure to thrive, so it was the infant that couldn't gain weight and had diarrhea. You can be a 70-year-old constipated male and develop celiac. So it's something that can develop at any time in life. So that's one thing that's really changed. And when you look at all the things associated with gluten sensitivity and leaky gut, which goes hand in hand, if we had a 400% increase in cancer or a 400% increase in heart disease, how do you think everyone would be reacting? Now, you know, why has it gone from 1 in 3,000 to 1 in 100 people? The genes haven't really changed. You know, something else has changed, and it really is environmental factors. I think a lot of it has to do with all the gluten that we ingest. And the other big factor is that gluten, if you remember the other slide, causes increased zonulin levels. What does zonulin do? Causes those gaps to stay open in the tight junctions. So it's just another factor that can contribute to leaky gut. So if you had 100,000 people, 25,000 carry the gene, 1,000 have celiac, if you were to measure blood in all these people, but only 50 are diagnosed with celiac. And celiac's the worst form of gluten sensitivity. So if we can have that, so 950 of the 1,000 go undiagnosed. So here's a new term that you're going to hear more about, non-celiac gluten sensitivity. So what does that really mean? Non-celiac. You don't have celiac disease, but you react to gluten. And whereas celiac disease is an autoimmune disorder where you actually make antibodies against the transglutaminase, that isn't the case with non-celiac gluten sensitivity. And there's no established biomarkers, which is to say there's no blood test that I can do on you and say you have non-celiac gluten sensitivity. Now, I think IgG food allergy testing is helpful in that regard, even though traditional doctors kind of dismiss IgG food allergy testing as worthless. We have helped lots of people with it. But the real way to see if you're one of these non-celiac gluten sensitive patients, there's only one real way to do it, and that's to do what? Elimination. Elimination. You've got to go off gluten for a couple months and see how you feel. There's really no other way. But in every human, when you ingest gluten, it increases zonulin levels. That increases the tight junctions, the gap between the tight junctions. So probably everyone reacts. So, you know, what percentage of the population is this non-celiac gluten sensitivity subgroup? Now, this has only been described in the last few years, and nobody really knows the answer. In my estimation, it's probably everyone, because if we can convince patients to go off gluten, almost 100% will notice some improvement. You know, it's close to 100%. And the ones that don't notice any improvement, I really question whether or not they did it. It's, well, did you go off gluten? Yeah, I tried that, it didn't work. Well, how long did you go off of it? Well, I didn't have any for lunch yesterday. You know, it's that sort of thing. You really need to go off of it for a couple months. And again, unlike celiac disease, this is not an autoimmune disorder. There's something else that's mediating this reaction. So this guy is sort of the very celebrated researcher. He's the one that discovered zonulin. He has done a lot of research on celiac disease. And his contention is, if you're suffering with symptoms that make you miserable and you really can't figure out what it is, try going off gluten for a while and see how you feel. And that's really the only way you're going to know if that's part of the problem. Now, at the same time, you'll have someone else who doesn't understand zonulin, who will say, oh, this is a fad diet, and, you know, this is all, you know, it's going to go away. I'm here to tell you, 20 years from now, we're not going to be looking back going, this was a fad, and all those gluten-free kooks have gone away. Why do you think the industry keeps going up and up and up? I'll tell you why. Because when people do it, they feel better. And there's not a day goes by I don't see a patient in the office and we're talking about this, and they'll say, I went off of it for a while, I really felt better, and I was stuck at the airport, grabbed a piece of pizza because that's all they had, and I felt miserable. And that's a true story just last week, but we hear that all the time. So why are autoimmune diseases on the rise? So autoimmune diseases are a disease where your body makes antibodies against native tissue when it shouldn't. And we'll talk about reasons why that happens. But if you look at autoimmune diseases, the incidence is just going up and up. And it's going up and up and up right along with the incidence of gluten sensitivity. And celiac is an autoimmune disease. When we talk about gluten sensitivity, there's celiac, autoimmune disease. You're making antibodies against transglutaminase or gliadin. And then you've got this whole non-celiac gluten sensitive population. When I was in medical school, if you saw a patient with lupus, for example, you got everybody in the room. I mean, you just didn't see that very often. And now you see it all the time. But here's the difference. The lupus patient that I might have seen in medical school, if you measured their anti-nuclear antibodies, the blood tests for lupus, they were off the chart. I mean, they were really elevated. And now patients have this lupus-like syndrome, and the anti-nuclear antibodies, which is a blood test for that, are not that high, and they get diagnosed by the rheumatologist with a lupus-like syndrome or a undifferentiated connective tissue disease, and so they don't really know. So it's a little different animal than what we used to see. So here's one of the things that happens when you have leaky gut. So if you can imagine a coffee filter, and now you punch holes in the filter and you pour the water in, what's going to happen? You're going to get coffee grinds, okay? So that's what happens with leaky gut. You're getting this backup of sewage, basically, from the small intestine into the bloodstream. So now this sewage is percolating throughout the bloodstream, and where is it going to land? It's going to land where you have filters in the body. So your joint fluid, the synovial fluid, is actually a filtrate of the plasma. So now that sewage is landing here in the synovial capsule, which is the lining around the joint, and then you get a local inflammatory reaction, so that's what causes the joint aches and pains. Your kidneys are filters, so you get inflammation there. So when you look at lupus, it's arthritis, nephritis, inflammation of the kidney. It can affect the brain or cerebritis, pleuritis, right? But that's probably what's happening as you get leaky gut. You get this systemic inflammation. It's not just confined to the gut. It's interesting to note, too, that when you look at celiac patients, or let me back up. Only about 40% of celiac patients actually have digestive symptoms. So you think of celiac as this digestive disorder when 40% of patients don't have any digestive symptoms, and they can present with simply an iron deficiency, or they might have fibromyalgia or migraines. And again, when I talk about gluten sensitivity, I'm talking about kind of leaky gut because it's just a big player. It's sort of like saying we're going to talk about World War II, where you're going to hear a lot about Hitler because he's the major villain in that war, but he's not the only bad guy. So this is something else that's changed a little bit. What causes autoimmune diseases? Now, we were taught two things. You have a genetic predisposition, and the second thing is you have an environmental exposure. So this is all autoimmune diseases. So look at celiac disease. You have the genes, which have been described, and then you have an environmental exposure. Well, the environmental exposure is exposure to gluten. So if you have the genes and you're never exposed to gluten because you're eating a rice-based diet, are you going to get celiac disease? No. But here's the third thing that has to happen before you get celiac disease. So 25% of the population has the gene for celiac, 1% has celiac. So what's going on? What's going on with the other 24%? Why do they not have celiac? Something else has to happen to increase mucosal permeability. Then the celiac gene is triggered. So what are the common things that can cause increased permeability? taking medications like ibuprofen, going on a chemotherapeutic agent. Probably the most common thing is taking a long course of antibiotics for something else. A lot of times antibiotics you may not have needed. So you're carrying the celiac gene, you take an antibiotic, let's say for a chronic sinus infection, that changes the balance of good and bad bacteria in the gut. That causes inflammation, upregulation of the immune system in the small intestine. That causes the gut to leak. Now you get celiac disease. Does that make sense? Mm-hmm. So that's why not everybody has it. Something else goes on with this increased permeability that triggers the celiac gene. So this is from Dr. Fasano, the same guy I showed you the picture of, and I just really like this quote. I mean, this new paradigm subverts traditional theories underlying the development of autoimmune diseases and suggests that these processes can be arrested if the interplay between genes, the environment, triggers is prevented by reestablishing normal intestinal barrier function. Fix the leaky gut and you quit or you stop the regulation between the genes and the environment. And when you look at how much autoimmune diseases have gone up, what are the costs, how profound this is, it's huge. So you can go ahead. So here's another concept that's sort of interesting, and this is a concept called molecular mimicry. So what happens with molecular mimicry? So proteins are made up of sequences of amino acids. And this is the gluten protein, and so you've got this sequence of amino acids. And if this sequence of amino acids mimics or is closely or very similar, let's say, to amino acids in your thyroid tissue, for example. So gluten sensitivity, celiac disease, and Hashimoto's thyroiditis, which is the most common cause of an underactive thyroid, there's a strong relationship. And it may be this molecular mimicry as another one of the factors that can trigger an autoimmune disorder. But what happens is if you've got leaky gut, you've got larger sequences of amino acids that are being absorbed into the bloodstream. Okay? So you've got a protein in your intestine, you've got protease enzymes that are breaking the protein down into smaller amino acid sequences. Well, if your gut's not working, you're going to get larger sequences into the intestine, or I'm sorry, into the bloodstream that might trigger this sort of autoimmune reaction. So what do we do? I mean, we suspect you've got leaky gut syndrome. You know, what do we do to try and help you with that? And I call it the 4 R's approach. The first thing is you've got to remove anything that might be contributing to the leaky gut. And the thing to look at there are medications like ibuprofen, pathogenic microorganisms like yeast overgrowth, and then food intolerances, gluten sensitivity being the prototype. So that's the first thing. If you're ingesting something that's making you sick or you've got some bad bugs in your gut, we need to get rid of that. The second thing is to replace anything that you might be deficient in. Now, when we showed the other slide of all the things that might be associated with leaky gut, you saw magnesium deficiency, iron deficiency. Leaky gut can cause hormonal imbalances. It can cause neurotransmitter imbalances, which in turn can cause mood disorders and so forth. So we want to remove anything that's making you sick, replace anything that you're deficient in. We want to re-inoculate the gut with probiotics. And then the last thing is to take something to specifically repair the leaky gut. So the first thing to look at is foods. And I like this quote: people are fed by the food industry, which pays no attention to health, and are treated by the health industry, which pays no attention to food. And there's probably a lot of truth to that. I want to take a minute to talk about food intolerances and food sensitivities, because you might have a test, some test that says, well, I don't react or I do react. And when you look at food intolerances or food sensitivities, there are a lot of different mechanisms that can underlie food intolerances and food sensitivities. So let me see if I can help you understand that. So here's the spectrum of food reactions. On the one hand, you may have enzyme deficiencies. So lactose intolerance, which is very common, is a deficiency in the enzyme lactase. If you don't have enough lactase, you don't break down the complex carbohydrate lactose in dairy products. It goes unfermented into the colon where the bacteria work on it. You get gas, bloating, diarrhea. So that's lactose intolerance. You can have pancreatic enzyme deficiencies. You can have, there's a new enzyme deficiency you're going to hear more about called Diamine oxidase, which causes you to react strongly to foods that are high in histamine. It may be a cause of chronic hives, for example. So you're going to hear more about Diamine oxidase. That kind of goes back to leaky gut, because if you have leaky gut, you leach out the Diamine oxidase in the small intestine. So you've got enzyme deficiencies. You've got some foods that might have a direct irritant effect. So for example, if you have heartburn and you drink orange juice, it's going to make it worse by virtue of the acidity in the orange juice. The other reactions might be more of on a pharmacologic basis, or let's say drug side effect. So you may react to MSG or aspartame. And we're going to talk a little bit more about that. We actually did a study in 1994 to see if MSG was a trigger for irritable bowel syndrome, and we fed patients a meal with and without MSG, and the study was positive. And I found at that time it was easier to make people sick than it is sometimes to make them well. So you can have, direct pharmacologic effects like caffeine, MSG, aspartame, and then you get into the whole range of immune-mediated reactions, and this is where the immune system gets involved. And you've got IgE antibody reactions, which the allergists are really all over. That's where you might have the skin testing, but that's really looking for IgE reactions. You have IgG reactions, IgA, and then you can have things like gluten that you may react to on the basis of increasing Zhan Yulin and making your leaky gut worse, and it's not even an immunological reaction. So the first thing is to remove. So here is another kind of case study. This is a patient who had weight gain, high blood pressure, and fatigue. Those were her main symptoms. And we're still talking about removing in food allergies. One of the participants tonight, we were talking about food allergies and when you do them, and I've kind of changed when I do food allergy testing, and I'll show you why here in a second. So if we can have the next slide. So here's a patient, here's all these different foods, and the foods aren't that important, but this means you're reacting. Green means you're okay, but when you start getting out here, you're reacting to this many things. Generally, they have a leaky gut. So remember what I said earlier about if you have a leaky gut, now you're getting larger, undigested protein molecules into the bloodstream. That's what's causing, all these different reactions. So this patient went on what we call our leaky gut protocol, which we'll talk more about. And then here's the follow-up slide. See how everything's kind of quieted down? So if we'd have done food allergy testing early on, then we might have had this person avoiding all these things that they really didn't need to avoid if their gut was actually working like it should. And indeed, there are some things they're still reacting to. So if we can have the next slide. So the next thing I want to talk about is removing pathogenic microorganisms. And there's different tests. And a lot of these tests that we're going to describe tonight are kind of what I call cutting edge specialty tests, not usually covered by insurance companies. And the IgG testing, again, if you go Google IgG testing, you'll see traditional conventional docs that kind of dismiss it as worthless, and it couldn't be further from the truth. So this is a test that looks for the pathogenic microorganisms. So if you've got some weird parasite, if you've got yeast overgrowth, if you've got a pathogenic bacteria, we want to know about that because that can contribute to leaky gut. And this test is based on DNA technology, so it's the same technology that would put the criminal at the scene of the crime, right? But the criminals we're looking for here are pathogenic microorganisms, not the bad guys. So if we can have the next slide. So here's an actual patient. The first slide looks for the good guys. So here are you want to have plenty of these, and this patient had been on probiotics and they've got plenty of the good guys, so that's a good thing. You'll see some patients, if you do the testing, and they're way over here, and you go, look, you have basically a probiotic deficiency, you don't have enough of the good bacteria. So if we can have the next slide. So same patient, they had Helicobacter pylori and high titer and 3+ yeast. Parasite of unknown taxonomy, which really not sure what to do with this. A parasite of unknown taxonomy, that could be something you ate on a piece of lettuce that just passed through your system. One of the limitations of this test is it doesn't tell you if it's a disease-causing parasite. Now, there are known parasites. If they would have had Giardia, for example, that would have shown up. This just means it's a parasite. We don't know what it is. It's like saying you're a human. We don't know who you are. And it may not be causing a problem. I want to talk just a minute about, how many of you have heard of Helicobacter pylori? Okay, so I love the Helicobacter pylori story, if you will. But Helicobacter pylori was described in 1983 by Dr. Barry Marshall, who was a resident physician in Australia. And he suggested that Helicobacter pylori was the cause of ulcer disease and gastritis, or inflammation in the stomach. And he literally was laughed off the stage when he presented his findings. You know, that was heresy. I mean, ulcer disease, these people are stressed out, and it's imbalance between too much acid and mucosal defenses. And it wasn't until 1992 that it became accepted that he was right all along. And now, you know, every doctor knows that 90-something% of ulcers are caused by H. pylori. And the reason I like this story is the same thing's going to happen with leaky gut. What you're hearing tonight, you're going to be an early adopter. And 10 years from now, as this whole increased mucosal permeability and the Zhan Yulin story gets told, what's got everybody interested now, we've discovered a molecule, Zhan Yulin, so let's discover an anti-molecule, so the drug companies, as soon as they get interested in something, then they're all over it. H. pylori, in addition to ulcers and gastritis, has also been associated with chronic hives. And if you Google H. pylori and hives, you'll see it's been described. And we've seen a number of patients with chronic hives where you break out in whelps for years, years and years. And we got rid of the H. pylori, got rid of, fixed their leaky gut, and the hives went away. And these are people that had been on prednisone on and off for 17 years in one case. And then this whole notion of yeast overgrowth, it was a Dr. Crook, in the 80s who wrote a book called The Yeast Connection, and everybody thought, oh, this is kind of wacky. But you know, if you have vaginal yeast infections, I mean, what's to say the yeast is not going to get in your small intestine too? So I think this is a real common problem, and you can begin to see how it all kind of ties together. This may have triggered activation of the celiac gene that you've been carrying around, because this caused increased mucosal permeability, or maybe this caused increased mucosal permeability. So you really have to address all of it. It's not like just do this and you're going to be fine. So we put this patient, now remember the other patient we showed you the food allergy test before and after our leaky gut protocol. This patient went on the leaky gut protocol for 3 months. We did not give them any antibiotics to treat H. pylori. So the traditional treatment for H. pylori is a couple antibiotics and acid blockers. It's pretty intense. And another issue with H. pylori is it's difficult to say whether it's even friend or foe. I mean, if you get it early in life, it may actually be good for you. So that's kind of one of the bizarre things about H. pylori. So if we can have the next slide. So here's the good bacteria, no real change there. And next slide. So H. pylori gone and no yeast. So that's pretty impressive. This is the first patient that we've actually done a pre and post stool test. So I'm hoping that we'll, another year we'll be able to report, look, we've done this on 50 patients, and this treatment, natural treatment, has actually gotten rid of these pathogenic microorganisms. So if we can have the next slide. I want to talk just a minute about water, because this is one of my things that I think is kind of fun and interesting and a lot of people don't know about. We talked about the patient that had the reflux, and we talked about how orange juice is going to make reflux worse because it's acidic. Well, what a lot of people don't realize is the pH of water varies. So if you look at Fiji, for example, it's the only one I'm aware of that actually puts the pH on the back of the bottle at 7.4. Well, if you remember chemistry class, normal pH is around 7, right? And that's what you want to be. And what we're going to do is we're going to take, this is soda, these are two of the most popular brands of bottled water. Here's an example of a natural spring water. Here's water from the tap, and here's water that's been run through an alkalinizer. So we're going to put some of these pH drops into the water and we'll see what we get. So you're looking at a pH of around 4. Well, orange juice is about 4.3. So if you have heartburn, you don't want to be drinking water that has a pH that approaches orange juice. Well, and I had dinner the other night with a guy who's teaches about water at Metropolitan. I don't remember his exact title. And we were talking about this. He goes, well, no, that's not possible. I mean, water, distilled water, for example, is going to have a neutral pH. We'll take some drops and put it in distilled water, and it's going to look just like this. What's happened is they've taken municipal water and they've taken everything out of it. Okay, so let's take that water and let's run it through all these filters and take everything out of it, which is good to get the impurities out and to get the chlorine out. But when you take the calcium and magnesium out of water, that is what makes it acidic, because you're taking the positively charged minerals out. And he and I argued back and forth. I said, you have a lab, you go check the water, and you call me and tell me. And this is something you can do. I mean, the pH drops, put it in there, see what happens. So if you were to evaporate this water, guess what you would get? Nothing. Now, if you evaporated your tap water, you're going to have some white scale, right? That's the calcium and magnesium, the positively charged minerals. And that's one of the reasons we're seeing so much magnesium deficiency, is everybody drinking all this bottled water and thinking it's great. So it's more than just not being so good for your heartburn. It's devoid of the minerals that we need, which I'll get a little tangential for a second. People that are obsessed with avoiding salt. You don't need to avoid salt. Now, check with your doctor. I have to give the usual disclaimer. Salt is not public enemy number one. In fact, a lot of people are deficient in the minerals that you get in sea salt. So you want to do a good sea salt that's got 50 to 80 minerals in it that you don't have in table salt, which is just sodium chloride. So a lot of people, when I tell them that, so you need minerals, you need calcium, you need magnesium. Our diet is just really devoid of a lot of these good things. So that's kind of the water story, but that's something we always talk to patients about in terms of removing. You know, I mentioned MSG, so-called neuroexcitatory amino acids, MSG and aspartame. And again, this is one of my areas of interest. We did a study on MSG back in 1994. And I want to take a minute just to explain what happens. So MSG is the sodium salt of glutamic acid. Glutamic acid is an amino acid. And amino acids are building blocks for proteins. Remember, we showed the sequences in the molecular mimicry. So amino acids are building blocks for proteins, but they also serve as neurotransmitters for the brain, or at least substrates for neurotransmitters for the brain. So MSG has glutamic acid, aspartame has aspartic acid. Both of these amino acids stimulate a receptor in the brain called the N-methyl D-aspartate receptor. Now, I know this is getting a little technical, so bear with me. So you've got a receptor in the brain, the N-methyl D-aspartate receptor, that is stimulated by glutamic acid and aspartic acid. Now, you have a drug to treat Alzheimer's called Namenda, which blocks the NMDA receptor. So on the one hand, you've got two common food additives that stimulate a receptor that's blocked by a drug that's used to treat Alzheimer's. And MSG can treat, how many of you are MSG sensitive? I mean, if you're MSG sensitive, you're sensitive to aspartic acid too, because they stimulate the same receptor. Well, we talked about Zhan Yulin and how it affects the permeability of the small intestine. It also modulates the permeability of the so-called blood-brain barrier, which is a very selective barrier that tries to limit bad stuff from getting into your brain, particularly toxic stuff like glutamic acid and aspartic acid. But Zhan Yulin also increases permeability of the blood-brain barrier. So not everyone reacts to MSG the same way that really sensitive people do. So why do some people react more than others? Well, I'm sure if you check Zhan Yulin levels in the overreactors, if you will, or the highly sensitive people, you're going to find those Zhan Yulin levels are elevated. So that's kind of the gut and the brain and why some people are more sensitive to food additives than others. Bad stuff, by the way. So we're sticking with removing, so we want to take stuff out that's bad. This is a biggie. I don't know if any of you have seen, I mean, and there's real science looking at genetically modified food fed to pigs and looking at the lining of the intestine before and after. But this is, what we're doing here is a huge experiment that's going to turn out to be very bad in the end. How many of you have seen that? Shirley, I saw you shaking your head. You've seen the stuff on the, and this is real. I mean, this isn't some conspiracy theory made up junk. Excessive bile acids, I mean, there's a subset of patients that makes too much bile acid. That's a persistent irritant for the intestinal tract. That's something that can be addressed. Alcohol, antibiotics is a biggie. I mean, we see a lot of people, they're doing great, and then they take a prolonged course of antibiotics, and bam, now they've got lots of problems. Food allergies, gluten, antibiotics, we've talked about. So if you want to help someone with a leaky gut, the first thing is to remove anything that might be contributing to it. So now we've removed everything that might be making you sick, and now we're going to replace anything that you're deficient in. You can get a lot of nutritional deficiencies from leaky gut. This is a biggie, and we're going to talk more about iron deficiency in a minute, but B12 we check, folic acid we check homocysteine levels, which are elevated if your folic acid's low. This is huge. You know, 30 to 50% of the population is deficient in magnesium. And if you have a leaky gut, you're just more likely to be deficient in magnesium. And if you're drinking water that doesn't have any minerals in it, you're more likely to be deficient in magnesium. But there's over 300 functions for magnesium in the body. And I want to take a minute just to talk a little bit more about this. You've got to be careful when you take things like vitamin D. So vitamin D is really good for you. But you need magnesium to convert vitamin D to the active form of vitamin D, which is 25-hydroxyvitamin D. So if your magnesium's a little bit low, and that's caused your blood pressure to be high, and that's caused cramps in your legs at night, and now you start taking vitamin D, which is a good thing, that might drop the magnesium level even further. One common manifestation of that is ringing in the ears. So we see a lot of patients that get ringing in the ears when they start taking vitamin D because they were magnesium deficient to begin with. And magnesium's a little tricky. If you get our e-newsletter, I just wrote something on, you know, the different forms of magnesium, magnesium salts versus chelated magnesium. So for example, if you want to treat constipation, use magnesium citrate, which is not very well absorbed, increases intestinal motility, but it's not going to raise your total body magnesium levels. If on the other hand, you've got high blood pressure, so think of magnesium as relaxing everything, including your emotions, and so it helps you sleep. It relaxes the blood vessels, one of the best natural treatments for high blood pressure. But if you want to increase magnesium levels in the body, then you want to do a chelated form of magnesium, which has a couple amino acids on it. When you ingest it, it's very well absorbed. Then you can get hormonal imbalances as a result of leaky gut. Adrenals we like to check. You can get thyroid imbalances. We talked about the gluten, Hashimoto's thyroiditis link. And this is a biggie too. A lot of patients get mood disorders, neurotransmitter imbalances as the result of nutritional deficiencies. And on the next slide, we'll use iron as an example. So ferritin we check in everyone. Ferritin, if it's too high, that's bad. That's called hemochromatosis. If it's too low, that's bad. And iron is a cofactor for the conversion of tyrosine, which is an amino acid. So you need iron to convert tyrosine to dopamine, which is a neurotransmitter. And you can get iron deficiency on the basis of leaky gut. You can get iron deficiency like the first patient that I described. She had restless leg syndrome, which is a symptom of low dopamine. She had low dopamine because she had low iron. She had low iron because she was on acid blocking medications. Using meds like Prilosec all the time, like there's no bad unintended consequences, is not good. I mean, acid's in our stomach for a reason, and if you don't have any, it interferes with the absorption of a lot of vitamins and minerals, which in turn can lead to neurotransmitter imbalances. So what are the symptoms of dopamine deficiency? So anyway, this just shows iron as a cofactor in conversion of tyrosine to dopamine. You need B vitamins to convert tryptophan to serotonin. So we see a lot of people with mood disorders. We do neurotransmitter checking, so you can check dopamine levels and you can check serotonin levels, and they're way out of whack. We had one patient who was depressed to the point they were going to do electroconvulsive therapy. And we did neurotransmitter testing, and his serotonin was almost undetectable. And at the end of the day, all we did was give him 5-hydroxytryptophan and B vitamins to naturally raise his serotonin levels. I mean, that guy's not going to respond to drugs that just try and increase serotonin across the synapse, which is what the Prozac-type medications do. So if we can have the next slide. So again, just the same thing. So you've got an iron deficiency causing dopamine deficiency, and that can cause restless leg syndrome. So the drugs that are used to treat restless leg are so-called dopaminergic drugs. They try and increase dopamine. But that also can cause palpitations. So going back to our original patient, her palpitations were from one of these dopaminergic drugs that she was taking to treat her restless leg syndrome. ADHD. I had a 17-year-old high school student who came in, her ferritin level was almost undetectable, and her chief complaint was, I just can't stop thinking. She had ADHD on steroids. And at the end of the day, she was having heavy periods that were causing her to be iron deficient, that were causing her to be dopamine deficient, and we got her periods kind of straightened out, got her iron level up, and now she's back in school. Apathy and depression. Dopamine's the feel-good neurotransmitter in the brain, so you're going to be depressed, apathetic, restless legs. Everybody with restless legs should have their ferritin level checked, and more often than not it's going to be low. And even if it isn't that low, then a lot of times they'll respond to iron. And here's just another point. When you're looking at your lab test values, and ferritin's a good example, the reference range is 15 to 150. It's huge. So how do they come up with these reference ranges? Well, they really should be called averages in the general population. That's not what's optimal. And I can promise you, if you took everyone whose ferritin level was less than 50 and compared it to everyone who was closer than 100 and did kind of a symptom questionnaire, you'd find out the ones that were closer to 100 are feeling a heck of a lot better than the ones that are below 50. And I just bring that up as an opportunity to talk about interpreting your own blood tests and the difference between what's an average in the general population and what's optimal. And it's difficult to lose weight if you have this dopamine deficiency syndrome. And we could, talk about serotonin deficiency, and I'm just using iron as one example of nutritional deficiencies causing neurotransmitter imbalances. So the next thing you need to do is re-inoculate the gut with probiotics, and here's somebody's eating some yogurt, and now they feel a lot better, but it goes beyond yogurt. So what are probiotics? Probiotics are the normal bacteria that we all need for healthy digestion. And the easiest way to understand how probiotics work is to think about how yogurt's made. So if you want to make yogurt, take milk, add Lactobacillus acidophilus, which is an example of a good bacteria, and then incubate the milk or slow cook it for a couple days, and then you're going to have yogurt. So what's going to happen if you take that same milk and you set it out for a couple days without adding the good bacteria? It's going to spoil or curdle. So those good bacteria in your gut are essential for normal digestion. And if you think of your small intestine, it's basically a big fermentation tank or a big yogurt maker. And if you don't have the good bacteria, forget it. And then that's one of the things that can contribute to, diarrhea, gas, bloating, irritable bowel syndrome, leaky gut. So you're doing pretty well. You take a bunch of antibiotics you might not have needed. Then you get an imbalance of good and bad bacteria. Now you can't ferment your food appropriately. Now you see how this all kind of ties together. So it's critical to make sure you've got enough of the good guys in your gut. So the next thing is to repair. So what can you take to help repair a leaky gut? Well, glutamine has been around for a long time. It's an amino acid. We talked about probiotics. We've known for years that good probiotics help IBS, basically helping leaky gut. So probiotics, prebiotics are the food that the bacteria need to eat. They will stimulate the production of your normal bacteria, your good bacteria. Omega-3s and omega-7s, aloe. But here's the real key, and this is an example of an immunoglobulin. And we're going to talk next about kind of our what we call leaky gut protocol. So if we can have the next slide. So this was sort of a life-changing event for me. Last year I was in Orlando for a functional medicine meeting, and a naturopath presented a discussion on leaky gut. And I was familiar with leaky gut, but it's the first time I'd heard a really nice formal presentation on leaky gut. And this was a combination of things that she used to treat her patients to help repair the leaky gut. But remember, before you go to this, you've still got to remove anything that's making you sick so that it doesn't keep going on. And the real secret in the sauce is the immunoglobulins. And the immunoglobulins do two things. One, they actually block the Zhan Yulin receptors. They're felt to block the Zhan Yulin receptors in the gut. But more importantly, they help rid your body of the pathogenic microorganisms. So the best way to think of the immunoglobulins is to think of breastfeeding. So you've got a newborn infant, has an immature immune system, and that baby's relying on the breast milk from mom to protect it, right? So it's the immunoglobulins that are transferred in the breast milk that protect that infant until the immune system is developed. Colostrum's been used for years to try and do the same thing. But this is a bovine-derived immunoglobulin, so derived from cattle, that's probably much more effective than colostrum or things you might use. Very effective. This has a lot of different things in it that help repair the leaky gut, like L-glutamine. It's a protein powder. So you mix this and this. This is a probiotic with Saccharomyces boulardii, which is a good yeast that helps to get rid of the bad yeast, which is a common problem. The Saccharomyces boulardii is kind of like a bouncer in the bar that throws out the bad guys. And this also has some of the immunoglobulins. So sometimes we'll just use this. But anyway, that's kind of our approach. Remove anything that's making you sick, replace anything you're deficient in, re-inoculate the gut with probiotics, and then take something to help repair the leaky gut. And have any of you here been on our protocol yet? Good results? Yes. I mean, it's been phenomenal. I've never seen anything like this. Patients with ulcerative colitis. I have a relative in California, 12 years old, UCLA Medical School, 2 years, bloody diarrhea, colitis, intravenous iron because she was losing iron. Within a month, she was no more digestive symptoms. And then it gets I wish that everybody had digestive symptoms. So I had a patient come in. Her husband had diarrhea, IBS, skin rash. I mean, he goes on our protocol. He's all cleared up. He's happy. So he sends his wife in, who's got this lupus-like syndrome. And so I said, well, do you have any digestive problems? She goes, no. I said, diarrhea, constipation, bloating, heartburn. I said, gas. Do you pass gas? She said, no. And I said, you never pass gas? She goes, well, not like my husband. And so I was really kind of curious after this, because I really like it when you have digestive problems, because it's hard to say we're going to treat your lupus with this stuff for your gut, but you don't have any digestive problems, because if you have digestive problems, those usually clear up pretty quickly. But this kind of got me thinking, so I did a little research, and I found that 1 in 5 people suffer with flatulence. Did you know that? The other 4 enjoy it. So we'll open it up to questions. You know, I think this is a key point to make, that, you know, you've got to treat the whole patient. I mean, you know, the gut is where you want to start, but there's other things to consider. And, you know, we see patients that really do have psychological issues that need to be addressed, and they might need to see a psychologist and so forth. But, you know, hopefully tonight I've convinced all of you to at least try going off of gluten for a while to see if you're one of these non-celiac gluten-sensitive patients. And I know it sounds, you know, impossible to do, really hard to do, but once you kind of get into the groove, it's not that hard. We have a nutritionist on staff, John Friedstein, who can help you. John, how long have you been off gluten?
15 years.
15 years? And then Shelley Hillesheim is a chef that works with us, and Shelley wants to teach you how to cook. You know, if you want to go gluten-free, you've got to learn how to cook. And I think cooking is a lost art form. I like to cook, fortunately. Worked in restaurants for a long time. But much like a personal trainer might teach you to exercise, Shelley will teach you how to cook gluten-free and to really do an anti-inflammatory type diet. October 17th, she's going to begin a series of cooking demonstrations, and they're going to be held in this room. So if anybody's interested, I think there's some flyers back there, and you can go on our website and sign up.